The real question isn't scarless or not, it is how visible, how long lasting, and how well planned the scars are. When minimal scar breast lifts are possible? Every time someone promises you a scarless breast lift, a surgeon somewhere quietly cringes. Not because scars are ugly, but because misleading patients are. Hi, this is Dr. Priya Bansal, your trusted female plastic surgeon for aesthetic breast transformations. Today, let's separate surgical reality from marketing fantasies. Let's talk about breast lift with honesty. Now, here's the first thing to understand. Any surgery that lifts the skin will involve some form of incision, that is basic anatomy. So, when you hear scarless breast lift, it usually doesn't mean no scar at all. It means minimal, well hidden scars that fade over time and are placed strategically to be discreet. The real question isn't scarless or not, it is how visible, how long lasting, and how well planned the scars are. When minimal scar breast lifts are possible? Now, in patients with mild sagging, we can often use a technique which limits the scarring significantly. Now, this technique they include periareolar, which means around the areola lifts where the scar it blends into the natural border of the areola. Then there is a crescentic breast lift when the breast is sagged a little bit. There is a crescent around the areola, crescentic excision around the areola, and the nipple areola is lifted a little high. So these are the two minimal scars techniques. But, and this is important, these options only work when the degree of sagging allows it, when the degree of sagging is very, very less. The truth no one likes to hear. Now, here's where I need to be very, very clear. If you have moderate to severe degree of sagging or significant excess skin after pregnancy, weight loss, there is no safe way to lift the breast with minimal incisions. But that doesn't mean you will have jarringly visible scars. Discrete incision planning is the key. In these cases, scarring usually means an additional short vertical scar and a horizontal scar which is hidden in the breast fold for greater degrees of sagging. These scars they are planned, they are controlled and placed in natural contours so they fade and remain discreet. Forcing a scarless solution in such cases will often lead to a weak or short lived lift and early drooping. Over time, this will result in widened scars or a need for revision surgery. Next time a surgeon promises you a scarless breast lift without a proper consultation or assessment, don't ask them for a discount. Ask for their board certification instead. Because we all know how that promise usually ends. What about lasers, threads, or fillers? Non-surgical treatments, they may offer temporary tightening, very, very minimal tightening, but they do not reposition the breast tissues or the nipple areola in a meaningful, lasting way. These are not substitutes for surgical breast lift. If someone tells you otherwise, that is just marketing. It is not science, it is not medicine. How surgeons decide the right technique? Now, during consultation, we assess the degree of sagging, the skin quality, the elasticity, the nipple position, the volume of the breast, and the goals of the patient. Based on these assessment, we choose the least scar technique which still delivers a stable and a natural lift. Because the goal isn't just fewer scars, it is a result that holds its shape for years.